One may just be lack of knowledge about what residencies entail. They hear, that they're equivalent to like 3 to sometimes even people say 5 years of practice. And I think that can really overwhelm some students who are not quite sure as to whether they, want to pursue residency training or not. So I think part of it is just maybe a little bit of intimidation there. Secondly, I also think that they're not sure if that is really going to benefit them in the long run, or it's going to put them in their trajectory, like where they eventually want to go. And I always tell students, I'm like, you should think backwards. Like, what is your ultimate goal? Where do you ultimately want to be in your career? And then work backwards from there and ask yourself, is a residency one of those necessary steps in order to get to that, versus should I do a residency or shouldn't I do a residency? I don't know if that's the vital question. I think the vital question is, where do you want to be, and is a residency a big part of getting there? Probably the other thing I would say is that simply just cost, and the fact that residencies do pay less than traditional pharmacy jobs, and some students have debt from college, from many, many years of college, and they are concerned, even though they can defer their loans, they're concerned about having enough money to pay off their loans, and they want to just get out into the workforce.